Right now in British Columbia, are simple changes that could dramatically affect access to care for patients with back pain, injuries, and other musculoskeletal problems. But those changes haven't happened yet. Let me explain what's going on. Musculoskeletal pain is one of the most common reasons that people seek healthcare. About 30% of visits to primary care are for musculoskeletal conditions like back pain, neck pain, headaches, sports injuries. And chiropractors are already trained to diagnose these conditions and manage them. But in BC, there are outdated rules that create unnecessary barriers for patients. Here's a common scenario. A patient comes to a chiropractic clinic after an injury. The exam shows that they likely need an x-ray to rule out something serious, like a fracture. The chiropractor already knows that imaging is needed. But under the current system, the patient usually has to go to their family doctor just to get the imaging requisition signed. This creates delays and unnecessary appointments. This isn't just an inconvenience. This extra step creates delays and unnecessary appointments. In fact, the current system leads to about 1.4 additional family physician visits per patient, which adds up to more than 107,000 unnecessary doctor visits in BC. From a financial standpoint, that represents roughly $4.1 million in avoidable healthcare spending annually. But the real issue isn't the money. The real issue is that those unnecessary visits take up valuable primary care appointments that could be used for patients with more complex medical needs, and more importantly, it delays the patient in getting the proper care for their condition. BC Chiropractic Association is proposing a simple policy update to allow chiropractors to refer patients directly to publicly funded diagnostic imaging. This wouldn't increase the number of x-rays being ordered. Instead, it would simply allow medically necessary imaging requests to come from another qualified healthcare provider and improving the system efficiency. Many other provinces already allow this. The goal is faster care, fewer unnecessary doctor's visits, and better use of our healthcare resources. Chiropractors are already trained in diagnostic imaging. Chiropractic education includes hundreds of hours of imaging training and national exams on interpreting imaging studies. We are well trained, well positioned, and well educated to make these decisions to help our patients get better quicker. There is also a second proposal to be discussed. Modernizing the chiropractic scope of practice in BC to allow needle stimulation techniques like dry needling and IMS. These treatments are already used by chiropractors in most of the other provinces and are commonly used to treat things like muscle pain and chronic musculoskeletal conditions. These proposals are about improving access to care. They would reduce unnecessary doctor visits, free up thousands of primary care appointments for physician and nurse practitioners, speed up diagnosis of and treatment of musculoskeletal conditions, improve system efficiency, and give patients more choice in how they choose to receive their care. At the end of the day, this is about modernizing healthcare in British Columbia. Patients should be able to access the right care from the right provider at the right time. And right now, there is an opportunity to make this happen. If you care about improving musculoskeletal health and care in British Columbia, this is an important conversation to be part of.